Morning and welcome and good afternoon for those folks people who are joining us from elsewhere around the globe. Welcome to yet another of our thematic innovation ecosystems, co-hosted by the ECH Alliance, the Digital Health Global Health Connector, and also by the Digital Health Uptake project, which is, as you'll find out, funded through Horizon Europe. Today's thematic ecosystem is going to be looking at the whole subject of remote care, and also how that is best helped to enable adoption of digital health solutions. But before we carry on, I'll just do, for those people who joining us from outside of the organisations that are here today, a couple of bits of information for you, just by way of housekeeping for those people who joined us. If you've got any questions, etc., you can post them in the Q&A. We will also be collecting some questions towards the end, so there'll be a chance that later on for some questions. All the resources you see here today will be shared with all the people who've registered. But a bit of information about us in terms of the ECH Alliance. The ECH Alliance, we're the Global Health Connector, been around for about best part of 13 years now. We're a member organisation, okay? And we bring over 1,100, nearly 1,200 members together in a network of over 80 ecosystems around the globe. I'll talk about those in a moment. But as a member organisation, what we tend to do is seen here in front of you. So we have 4 offerings for our members, which are quite clear, based around being that connector, hence the title, but also connecting people from across the globe to try and match up needs and solutions. We convene people together in ecosystems such as this, alongside colleagues from our ecosystems in Extremadura, but also Västerbotten. So hi Niklas, good to see you joining as well. But also to bring people together in some of our global events, which we'll talk about as well in a moment. Thirdly, we amplify what our members do. So we're great champions for our members, whether that's some of the projects that Funde Salou have been involved with, or some of the links that Region Västerbotten has got up in North Sweden, but also for some of the patient organisations, some of the universities in our network, because our network is made up of many not-for-profit organisations, buyers, etc. People like hospitals, government bodies, universities, social care organisations, patient groups, networks and associations, as well as companies. And then lastly, we enable acceleration of innovation from country to country, region to region, and more recently, continent to continent. So when we talk about ecosystems, we're quite focused. It's not a big science. There's nothing complicated about these. These are permanent multi-stakeholder gatherings, bringing together all those people you can see in the diagram in front of you. But their primary focus is around matching need and solution. So they're not tech shows. They're not people talking about being successful writers. They're not academic forums. These are around matching need and solution. And we use these to break down silos, because healthcare has got a particular issue around silos in terms of people not talking to each other and trying to reinvent the wheel. Secondly, we use them to transform healthcare delivery. What does that mean? Well, that actually means doing something as opposed to talking about doing something. This is something that's frustrated me for over 35 years in health and social care. And hopefully these ecosystems have started to help to build these, and we'll see this today. Lastly, they're there to create economic growth, okay? Because that's the largest spend for many countries, is within health and social care, matched with education. So we've got a network of these ecosystems all over the globe, ranging from Argentina to Zimbabwe. So why do I mention Zimbabwe? Because they're very much interested in this area too, and focused on this area in terms of remote healthcare, because that existing provision isn't there. But also, we've got ecosystems in Australia that link to some of our project partners here. And this list you see in front of you, which is already out of date, but there's a strong European element within Finland, Sweden, Spain, England, etc. But that's growing, and we're opening up new ecosystems, whether it's in Singapore just recently or in Los Angeles. If you want to find out more about those, join us, and then use this as a landing zone for your either innovation, your program, your company. This is a giant intelligence network. So, we've got experts here from Funde Salud or from Vastavan who can be that connector for you in that network. What we've also done, as well as develop this international network of ecosystems, is use these as a collaboration network. And many of these collaborate in some of our successful projects, such as Digital Health Uptake. My colleague Caroline is here, who leads a really successful team building proposals with our members, with our ecosystems. So again, another reason to become a member of ECH Lands, because most of our projects, just like this one, contain our members. But what we've also done is build a network of thematic ecosystems. And this is one of these just sprung up for this project around remote care, remote services in healthcare. But you can see here the range of different thematic ecosystems we do and the different topics. Again, same concept, matching need and solution, but bringing together all those players, but from different countries. Instead of being on a vertical in a country, such as located just purely in Extremadura, but actually virtual, bringing together input from Canada, from India, from Australia, from Sri Lanka, in a way that we couldn't do if it's face-to-face because of the cost. So if you're interested in any of these ecosystems, also contact me, Andy at echalliance.com, or drop me a message in the chat function below and we'll make contact with you. Again, all these presentations will be made available for you from today. Many of you I know will be coming along to one of our partner programs we're taking part in June at Health Europe. There's a code there if you need to register. You can scan the code with using a QR code here and you'll save yourself 150 euros on the price here. We'll be there showcasing many of our ecosystems and projects in 2 exciting partner programs we've got for Health Europe. Added to that, if you like the flavor of that one, come with us to Health in Las Vegas. Some of you have already been involved with this. Again, we're setting up a global village there, the 2nd year on the row, where we have a stage for our global village, as well as great innovation networking opportunities with our partners at Health. That's enough from me. I'm going to hand over to Carmen. Carmen, over to you. Tell us about today's program.
Okay, thank you, Andy. Hi, everybody. Welcome to our webinar. I will share my presentation with all of you. Do you see my screen in full screen?
Perfect.
Okay, today we will be discussing about the uptake of digital health solutions in remote areas. This webinar is organized by Digital Health Uptake. And I will not be alone. Today we will have with us Niklas Forsley. He is a project manager that works in the Center for Rural Medicine of Region Västerbotten. Sofia Moreno Perez, the director and co-founder of Valdeïnnova. And last but not least, Aline Loiset, who is the founder of Digital Health Connector. Before giving the way to the speakers, I would like to show you the agenda of this webinar. Firstly, I will show you a short introduction about the entity where I work. And after that, the speakers will present their project, the CRANE project, the Russia project, and the Indo-Major project. Finally, we will have a roundtable discussion and some questions from the audience that they can write in the question and answer section in the Zoom. Let's go with the introduction about Funde Salud, our entity. Funde Salud is a public foundation that belongs to the Regional Ministry of Health and Social Care of the Government of Extremadura. Our foundation manages the research and development that takes place in the healthcare system and the social care system, and we are in Extremadura. Extremadura is a region of Spain that is not heavily populated and is geographically dispersed. This is our department, the Scientific Coordination Area. Jonathan is the scientific coordinator, and we are a multidisciplinary team with people from different fields. In Fundesalud, we are working on several projects related with health, active aging, but more related to the topic that we have today are the following projects related with digital health solutions in remote areas: the D-Rural project, the service marketplace for European rural areas, the CRANE project that will be explained by Niklas, comprehensive treatment of chronic patients in rural areas, the Innovator project that will be covered by Aline, Fast Track to Innovation Procurement, and the JACARDI project. It is a joint action on cardiovascular diseases and diabetes. And now Niklas will present the CRANE project. Niklas, the floor is yours and you can present yourself.
Thank you very much, Carmen. If you stop sharing, I'm going to steal the screen from you. I hope you can see the
Yes.
my presentation. Yes. Very good. Yes, my name is Niklas Forsting. I work as product manager, as was mentioned, at something called Center for Rural Medicine. We are a very small R&D unit in the inland of Västerbotten. What is unique about us is that we're having very few people living in our area. Our municipality is one of the largest in Sweden. We have 6,000 people living there. Approximately 0.7 people per square kilometer, and we're performing the same type of healthcare and care as any other city are doing in Sweden, according to the legislative frameworks that we have to apply to. So we have gone into this project together with Extremadura, but also some other regions such as region Agder in Norway, represented here on the screen on 4 municipalities. And you can see the 2 areas taking part in Extremadura in this project. CRANE has a vision about breaking the silence, as was one of the main objectives of this organization, as was introduced at the start of this meeting. And we are trying to actually build a new infrastructure. When Sweden went after pre-war, Sweden invested a lot in infrastructure. We built roads. We had different type of broadcasting opportunities from television, and we also created water plumbing systems, and all this created then the opportunities of innovation of making televisions and different type of water toilets, and also building cars. So what we are seeing with CRANE is that we are now building a new type of you could say infrastructure to share data between different actors. And we normally take an example of Spotify just to make you understand what we mean by sharing data. Spotify is one way of actually listening to produce music, and but there are not only one Spotify, there are different type of Spotify. So you have Apple Music, you have Tidal, etc., etc., and all these different type of solutions are very similar, but they have a little bit different content and a little bit different approach too. And this is going to be the same with CRANE. But what we are not doing with CRANE, compared to Spotify, Tidal, and Apple Music, is that we are not moving data. Data stay where it's born, and we are going to make the data available for you as a citizen, so you have control and you can use the data for your purposes, and you can share the information of your data to anyone that you like to do. But Napster was a previous way of sharing music, where you actually downloaded the file and took it to your computer and listened to music from your computer. This is not what CRANE is. We're going to share data in a more sophisticated way. So our vision, as you can see coming up here on the screen, is very much aligned with your vision here. And if you read the last section here, unlike current siloed health and social care provision, Crane provides the citizens with open, trustworthy, I need to move, control of their own data and the use of it. And this is what we want to do. And to be able to do this, we have actually developed, to be able to do this, we understand that we need to walk quite slowly forward here. It's very easy that it becomes the plumbing creates a hole in the road, or that the different type of broadcasting systems are actually being disrupted and or damaged in any way. So building this infrastructure is very, very difficult. But we are aligning very much to the European health data space. In fact, our proposal on how to do this was presented approximately 1 year before European health data space shared their communication, and we're almost 100% aligned between the two initiatives. And when you read about the European health data space, it's very interesting because the first thing they say is that you will have access to your health data in electronic format immediately and without any cost. This is the future of health space, that you get access to your data immediately when you are with your primary care doctor and they take the blood pressure on you. It's also available for you at the same time. And this is the solution that we're going to create with Crane. To be able to do this, we have actually organized this into different building blocks. And I'm going to highlight a couple of them. The first building block is called data governance, and data governance relates to how we actually deal with the public data and patients' data. And we make all the data available for the citizens, and what we are using is a kind of app called My Health Enabler. And that enabler makes the data available from the different sources where the data is born. We don't move any data to a new site. We just use different type of technologies to be able to make the data available for the citizens. And this is automated, it's secure, it's anonymized, and it's also used by encryption. And with this data that you have control of, then you decide what you want to do with the data. You may only want to keep the data, so you have it to your disposal, but you may also be able to use the data that you have now to improve your own health, or be able to get some insights on what you should do to be able to improve your well-being. And so with that, we're actually providing different type of automated analysis connected to your data that you have now to your disposal. And what is also important when it comes to healthcare is to know the people. This is where many primary care centers have an upper hand compared to anyone else. They know their citizens well. And when we now build a system that are moving the opportunity to take care of yourself to the citizens themselves and their network of kin, then it's very important that the system knows the citizen. So it's very important to understand what you prefer as a citizen to be able to be able to match who you are with appropriate action. And the next one that we have, which is also a little bit different from traditional healthcare and care, is what we call the garden for care. If I describe garden for care, this is all the different entities that surround you as a person. It's multiple different entities that are that you meet in your daily life that are there to actually support you and improve your well-being. It could be a grocery store, it could be a personal coach that are training you, it could be your hockey club, football club, it could be also your primary care center and different type of doctors and social care workers, etc., that are all around you to improve your health and well-being. What we want to do is connect all these different entities to you, so you have them available. So when you do your analysis of what you should do to improve your health, then this is being matched with different proposals that Garden for Care have for you. So a proposal could be that you may are proposed to join a cooking course to learn how to cook better, so you could eat better food. It could also be that the grocery store are providing you with a list of food to buy for the next week, so you will improve your well-being. It could be also that the football club are sending you with a personal training scheme, so you could actually start practicing and become a little bit more athletic maybe, or whatever, to improve your well-being. So Garden for Care is the new way of viewing how to improve the people's health. And we also, in addition to Garden of Care, we speak about trend technologies. We use a different type of computing technologies that are available, such as multi-party computation, homographic encryption, and we try to compute either on nodes or different ways of preserving the privacy and security of the data of the people, so nothing is leaked. And in addition to all this is based on a value-based model, where we have, through numerous of workshops with different stakeholders that are involved in the Garden of Care, understood what value that they want to get out of this type of system. So we have a value-based model that are the foundation for this Crane solution. So how does this work? Well, I'm going to try to make a very simple explanation of this complicated system. First of all, we get to know the people. We know the individual user, what they motivate and their behavior. We look at their biodata context and whatever type of data that they want to provide us with. In addition, we have Garden for Care, which have a number of different public and private services that are available for citizens to use. And we have the My Health Neighbor that connects the two different spheres that are on one side, each side of your screen here. And with the My Health Neighbor, you could actually choose to get insights provided to you. And you can match those insights with different types of services from Garden of Care. And if you choose to conduct these services and you do new monitoring of your health, you will see improvement. You could see improvement of your health and well-being. And all this goes back to the people matter and the health data that are to your disposal. And then you could do a new way of insights and get new type of services that are matched with your current health data. So this is the system that we foresee in the future. And it will become a very dynamic system, a system that are supporting the individual and the individual development that people would like to have. So not only we're going to provide you with the control of the data, we're also going to provide you with the opportunity to take care of yourself and involve multiple different actors that are normally not seen as healthcare providers and social care providers, but are they actually there to improve your well-being and improve your opportunities to have a healthy and sound life. So that was my introduction to Crane, a very complex project, and I hope I didn't run through this too long. So I stop my sharing here and I leave the word to Carmen again. Please, Carmen.
Okay, thank you very much, Nikla, for your intervention. And now Sofia will talk us about the Rosia project. And now, Sofia, you can introduce yourself.
Hello, Carmen. First of all, thank you for inviting me to be here. Well, I am director of Balde Innova, that is a small consultancy firm specialized now in innovation procurement. And I have been a promoter of Rosia project and also now procurement innovator there. Well, could you see my screen?
Yes, we see you soon.
Yes, it's okay.
Okay, Rosia is the name of remote.
I cannot hear you now. I don't know if the rest are here, Sofia,
Sophia can't be heard.
or I have a problem. Sofia,
Hello, hello,
I can hear you now.
hello. Could you hear me?
Sofia,
We hear you now, Sophia.
Okay, sorry. Well, Rosia is an European project that that's funded under Horizon 2020. Rosia is a PCP. It lasts for 4.5 years. It will end in 1 year from now, and is led by EAX from Aragon, and has a budget of 4.5 million. I will say briefly what is a PCP for those who are not familiar with the concept. A PCP is a research project that starts from a need that is not covered by the existing solutions in the market for a public administration. It could be an public administration alone, or it could be shared by several different public administration, like in Russia. To solve this unmet need, the regions start a competition where different consortia of companies compete between them to offer the most innovative and adequate solution to the unmet need. The competition is made in phases, usually 3, and in each of the phases, the number of competitors is being reduced. In Russia, we are now starting the 3rd phase after the successful development of the 2 previous ones. So who are participating in Russia? In Russia, we have 3 regions, which are the region purchasing the solution being developed, the R&D solution that is not yet in the market and is needed in Dublin, Coimbra, and in Aragon, and some knowledge partners supporting procurers to do to execute the full project. So what is the problem being addressed by Russia? I live in the countryside. I live in rural areas. So this is a true story, the one I will tell you. My neighbor Domingo, who is a goat farmer, he got a knee replacement. And after the knee replacement, he need rehabilitation. So once per week, he wake up at 6:30. An ambulance picked him up and some other patients to bring them all to the hospital, where he got a 30-minute rehabilitation session, and he arrived home about lunchtime. It only lasted for 3 months, and at the end of the full process, he was never able again to walk through the forest. So he became disabled. And this reality is not only for remote areas. The insufficient rehabilitation services is a common problem in most parts of Europe. But in remote areas, it becomes unfeasible due to the big distances and the lack of resources to do so. The increase in the aging population is also increasing the need of rehabilitation, and the lack of rehabilitation creates an increase in disability. So it's something to really think about it. Rehabilitation also is boring, it's tedious, and it's long. So at the same time, we see that there are a lot of many fancy devices using deep cameras, sensors, gamification, virtual reality that makes rehabilitation a very attractive or fun experience, also very productive and easy to extend in the time, etc. So why are not using it? We are not using it because the telerehabilitation market is currently locked. It happens to also most of the IT services being developed. But why is locked? First, there is not an easy way to plug all these fancy devices into the healthcare IT systems. But we all here, we know that adopting technology in healthcare system is not only a question of interoperability, it's also that we need to change the care paths of the patients. And we need also to integrate those devices into these care paths. We need to educate and empower the patient to be able to use that. And also the development of this solution involves so many technologies that at the end of the day is complex and expensive and difficult to do everything. So how that could be solved? In Russia, the proposed solution includes an open platform to being able to integrate all the services and devices. So all those fancy things that I mentioned out there, to integrate them easily into the different healthcare system, to being able to have a market take up of many different solutions. We need developers to collaborate. So we need a developer layers, and to prescribe those apps, we need a catalog. But it's not enough. We need to change the processes internally. So we need support to implement integrated care approaches. We need to motivate, educate, and empower patients and carers. And we need the telerehabilitation solutions. And on top, we need a procedure to develop a value-based healthcare model able to help us to identify what to use and what to not. So this is the core of the ROSIA project, the development of these tools able to develop this ecosystem of developers bringing new solutions to the market in an easy way to jump into the healthcare systems. Carmen, I don't know if for how long I have been speaking. I was afraid of being too long. I think that
You can summary the rest of
Okay.
the.
I think this is enough for now. It will be even maybe better to have some time for discussion. Thank you very much.
Thank you, Sophia, for your great presentation. Now, Aline will present the InnoBudget project. Aline, the floor is yours. I think that my colleague Sarah will share the presentation for you.
Good morning, everybody. It's a pleasure to be here today. So my name is Aline. I've been working in digital health for the past 13 years, and I've been working with the TIC Biomed team on the InnoBuyer project. So what is InnoBuyer? Next slide, please. So InnoBuyer is a project financed by the European Commission, and it brings together big public and private organizations that we call challengers and innovative SMEs that we call solvers. And the idea is to create innovative solutions and to deploy them in healthcare systems. So it provides expertise and funding support for organizations with unmet needs, and it acts as a track to innovation procurement. So you see there's four different steps in that program. So what are the goals of the program? So first, to foster the development of an ecosystem to promote collaboration innovation between healthcare institutions and startups. Second, to launch and validate a support program to co-create innovation between those two profiles. And finally, to demonstrate the increase of efficiency of EU public services. So now we can have a look in more details at the different phases of the program. Next slide, please. Okay, so first we have action one is the idea is to identify and describe the challenges. So InnoBuyer is not only for healthcare, it's open to other industries, but with TIC Biomed, we support exclusively the healthcare institution, so hospital and healthcare institutions. So first step, action one, we help them to identify unmet needs within the hospitals and to turn those unmet needs into challenges. So meaning into like something that a startup can understand. So we help them to define what an ideal solution would look like to solve that problem, to define the nice to have, the must have of that solution, etc. And then action 2, that's when the hospital, healthcare institutions are presenting those challenges to the public, to SMEs. So the big part of that is the open market consultation. So we really work with them to present that challenge properly. And then we have webinars where startups can ask questions to the challengers, which help them to refine even more those challenges. And then SMEs can apply to propose their solution. And at the end of that phase, there's one solution who will be selected to go to the next phase, which is action 3. So we are currently in action 3. We started like a bit over a month ago. And action 3 is all about co-creating a pilot. So that's when the selected solver and the challenger get together for a 10-month pilot. So the idea is at the end of those 10 months to have a minimal viable product to validate that solution. So the co-creation process, it's quite free. So we give them some support from buyer of suggestions how they can do it. And we especially have like once a month, we have a check-in with them to see how things are going, how is the communication between them, is there any problems, can we help them solve those problems, etc. And then the action 4 after that is actually to work with the challenger to help them prepare for tender. So because ideally what we want at the end of the day is those institutions to come with a commercial agreement with the solution that were co-developed during the pilot process. So that's more action 4 is more like a legal support to prepare the tender with the hospital. Next slide, please. Yeah, so here you can see the different the consortium involved in that project. So there's 3 different companies. So I was telling you I'm part of a TIC Biomed team. So TIC Biomed is based in Spain, and we help healthcare institutions to define their needs and connect with suitable digital companies in the ecosystem. Then we have F6S. They are based in Ireland, and they help different entities around the world to promote, communicate, and disseminate technical and research projects. And then we have Civita, who are based in Estonia, and they help companies and startups to challenge their own industry and to become more innovative, efficient, and dynamic. And here you can see an example of projects. So those are the 5 projects that we are supporting from TIC Biomed. So they're all healthcare projects. So I will tell you briefly about each of them. So the first one, Bloodmansis, is from Fondesalud, that is present today. And it's an advanced blood transfusion management system. So what they're working on is a solution to improve blood donation in Extremadura in order to reduce the human errors and to streamline the process for it to be more efficient. Then we have Earlydale. The hospital is based in Madrid. So they're working on a solution to improve the identification of patients at risk of delirium during hospital admission in order to establish preventive intervention and to avoid complications during hospitalization. Then we have Farmaverso. They're also based in Madrid. They're working on an interactive digital environment to empower the patient who need to administer themselves with subcutaneous medication at home, so they know how to inject themselves properly. Then we have Preplex, also based in Madrid. They are working on an algorithm to help with prediction and planification of medical appointments to optimize resources in the hospital's outpatient departments. And finally, we have SafeStay. So it's a Polish hospital, and they are looking for offering wheelchairs and other mobility devices for visitors of the hospital so they can walk around the hospital more comfortably and safely when they need to come to the hospital. And next slide. So I presented you the different step of the program, and we currently have an open call, but specifically for SMEs who are part of EIC, that receive funding from EIC, so current funding or past funding. So they can present themselves together with a hospital, and they will join directly in the phase 3, so for the co-creation pilot. So we have 4 spots for that available. And they will also receive funding. So the hospital will receive up to 10K in equity, and the startup, the SME, up to 50K. And the application is open until the 6th of June. So I really encourage you to apply for that. And next slide, you can actually see the different information, the different website to learn more about InnoBio. Thank you.
Thank you, Ellen, for your clear presentation. And now I have some questions for the speakers for the roundtable discussion. This question is for everybody. What are the main challenges and barriers during the implementation of these kinds of projects in a public administration and healthcare system?
I can
Sophia?
start.
If you want, I may start. Well, Rosia, I think that the need and the way of solution could be pretty obvious, but the reality is that it is not there, and we know that even if we finish the development, even if we demonstrate its adequacy and effectiveness, etc., we have regulatory barriers because still in the participant regions, there is not a procedure to prescribe devices and apps. Also, we face a big problem, and is that there is not a proper budget already addressing what we want to deploy, and to create a new budget chapter is always difficult in an organization. And on top of that, we have to change the way the professional works in all the care value chain, including the patient. So change management is also a complex thing to address. And to me, these are the 3 main barriers that we are addressing.
Thank you, Sophia. Aline?
Yes. Well, Sophia, I agree with you. I think budget is a big issue for sure. I think that's where InnoBio is interesting, because you actually get money to do those things, to try this pilot. And what we found as well is the time. It's not easy for the teams to find time to do this, because they have to do their full-time job, and then on the side they have to work on those projects. And it's also a knowledge about innovation. When you found out is that oftentimes those teams, well, they are great at their work, right? Like in the hospital, like medical knowledge, but they're missing like the innovation knowledge. They don't know what innovations are out there. So when we try to define with them the unmet needs, that's fine, and we really help them to define it well. But when you don't really know what technologies are available out there, maybe that can make it a bit difficult to imagine what ideal solution could be. And something else that we found is also one of challenge could be the language, when like a healthcare institution and a startup are collaborating, a co-creation project like InnoBio, to talk the same language, because they have different rhythm, different expectations. So that's where I think our role here is also to help them, to bring them in the middle, put them on the same page, and to help them collaborate and communicate better.
Thank you, Aline. Niklas, now it's your turn.
Yes, I'll go back to what Sophia was mentioning about change management. I think it's very important to understand that I'm working for a health region then. it's important to understand that the design of the procedures of a health reading is developed by often professionals that are doctors and other type of well-educated people. And they have their own service models, and often the service models are designed to be fit for purpose of the unit that they work for. So it's very difficult to take one service model from one unit to another unit. In addition to that, what we are then proposing, like with Crane, is that we give all health data, make all the health data available for the citizens. And the citizens have control of their data. They know they should be able to see if someone is using their health data for any other purpose than what they have agreed to. And they can use the health data in the way that they want, as a citizen want. And they could easily take the health data, get a second opinion of a doctor's work, go to another doctor and get a second opinion of the health data. So what we are doing is that with Crane, we're actually moving the power from the healthcare system to the citizen. And by moving the power from the healthcare system to the citizen and empower the citizens with the tools to be able to take care of themselves, we actually take away the floor from the professionals, which has been their basis. And they have not been questioned in the work that they are doing. Of course, they see this as a challenge. So we need to explain them that you can become an even more of a superhero if you use Crane right. If you understand that you could also take in data from other sources if the citizen have that available, and if the citizen share that data through consent with you. So you could actually have a much more elaborated data set when you make your qualified decisions about the citizen's health and well-being. So it's a new way of thinking, and creating a new way or implementing a new way of thinking into a system that are very rigid and very evidence-based developed, I think is the main challenge.
Thank you very much, Niklas. I have other question for the three speakers. Why are remote areas such a good living lab for testing and co-creating these innovative solutions?
Should I start?
Yes.
Yeah, I mean, this is our pitch. I mean, working with an R&D unit in a very remote and rural area. I mean, what we are saying is that if you want to test anything, you should test it in an environment that are as simple as possible, with so little different complexity as possible. Any innovation development is actually made in an environment where you do a first viable product, a minimal viable product, and you test it at a very simple scale. And to be able to keep it as simple as possible, you can't have so many different type of healthcare entities that could actually be involved in this. And this is why rural areas are very appropriate for doing field testing and also develop innovation, because if you can work with the solution in a remote and rural area, it's easier to bring that to a more complex environment. But if you take a solution that are developed in a complex environment, you can't take that back to a very simplified environment. So using this minimal viable product tested in remote and rural settings, it's easier than to build different features on it later, to be able to scale and take in the opportunities which more urban areas are having.
May I add a couple of ideas?
Yes, of course.
Also, rural areas used to have a more intense problem related with the aging of the population. So the landscape that will be visible in the cities in 10, 20 years could be a reality in some rural areas. But I want to add something else. And it is that I'm convinced that if the solutions that will work in the future to radically change the approach to healthcare system that we have now will need technology, will need reorganization of processes, but it will also need social innovation. It will need to add some human factors in different ways to reinforce the community, to do things not only more efficient and more ICT supported, but also with different models of relationship. And to also experience that communities in rural areas is to be more easy to engage and to handle.
I would say even, Sophia, that communities in rural areas are used to collaborate. They have to collaborate to survive. So collaboration is not difficult for them. It's more difficult to understand why we shouldn't collaborate. So this is also part of the foundation, and exactly as you are saying, I mean the demographic challenge that we all are expecting to hit us in 20 years' time is already a reality in these remote and rural areas. And how do they survive? Well, they collaborate. I mean the municipalities and the healthcare services are performing integrated healthcare and care. They have to collaborate, otherwise they have too few hands to be able to take care of all the people. So collaboration is a rural model, and this is also part of why it comes a little bit easier to field test and to develop innovations in remote and rural settings. At the same time, it could become very annoying to the population if we do it too much and if we don't do it carefully. You have to have it well justified, and you have to have the support by the community before actually doing any intervention.
Yeah, we agree with Nicolas on that. I think it's important to understand your audience, what they want. Like when you see solution of like full deployment of digital solution, when the population's actually not, maybe they don't have a phone or Wi-Fi is not working, you have to take that into consideration. And maybe also to add to the questions of why remote areas are good living labs. So also agree with Nicolas that the advantage of rural areas is that you have like smaller structure, and maybe it's easier to do a test, to try your solution, to adapt your solution in those areas. And then there's like many different areas, many similar structures that have the same unmet need, and then you can just scale up. And those tend to be also related, like Nicolas, you were talking about collaboration, to scale faster and to also to have an impact on a large population.
I want only to add a small comment related with the availability of internet in rural areas. I think it has always been a problem, but now it's quickly declining. It's less and less relevant. I am now in the middle of nowhere, and my Starlink connections allow me to have good quality in front of you. And there are these disruptive technologies and the deployment of 5G, etc., have radically changed the reality in rural areas. And furthermore, in rural areas, people is not so digitally illiterated as it could be expected, because the need of purchasing on internet and the need of finding entertainment on internet is higher here than in urban areas. So I would say that, of course, for very old people, there is a gap, but not only here, but I think that also in cities. But for the population that is now my age at least, this problem is becoming less and less important. So increasing the chances of rural areas to be the best living labs.
Nice. We don't have much time, but I have one last question, specifically for Aline. In your opinion, among the different solutions that are being co-created, what's the most promising tool that may have a great impact on the healthcare system?
Well, that's a difficult question you're asking me, because I like the the 5 projects very much. I think they're doing all a great job, and they're all starting from a real concrete unmet needs from the institution. So this is a great base to have an impact. But if I have to choose one, I would choose Preplex with the project from Madrid. So they're working on that predictive algorithm that can help maximize the resources in the hospital. And I think that can have a big impact because it helps to identify, so in terms of people, of rooms, and of machines in a hospital, to maximize that use. And we know that what's happening today in the healthcare system is that there's like queues or like waiting time to access healthcare professionals, or to access a service, to access an exam. And by doing that, I think by understanding well the use of those different machine, people, rooms, we can really maximize that and bring patients to the healthcare system sooner. And that's very important when, like, you know, someone who has a potential cancer, or if they can come 2 months earlier, I think that can make a big difference. So I think that such an algorithm can make a big difference on patients' life, and also on the healthcare system, because it will, in terms of budget and financial, it will also have an impact for them, positive impact.
Thank you very much, Aline. Do we have some questions from the audience? I don't see anything in the chat.
I wonder,
Okay.
I was going to add in, if I could, is one of the things we see from when we look at our ecosystems outside of Europe, because obviously we've got very much a focus on Europe here, is there's a hidden issue in terms of adoption and uptake, and that's around trust. So you can invent tools, create connectivity, improve devices, but where there's areas which have issues with trust in the healthcare system, you'll see an impact in terms of uptake of solutions. So we've seen that in countries across Europe, with differences where people have trusted their governments in some of the recent pieces with the pandemic, and where they don't. And then you'll notice a difference there between uptake of not only digital health solutions, but other public health messages around food, obesity, alcohol, smoking, etc. And you'll see that outside of Europe as well. So where countries have high levels of trust to the government, there's higher levels of adoption of digital health solutions. And in countries where they don't trust the government, that uptake is much lower. Because why would you use a digital health solution as part of the system that you don't trust? And that's an issue that we see in both the US, but also in Europe. And by Europe, I mean the UK. And obviously, I think Nicholas is going to share what that trust is there, certainly in the Nordic countries. And it's astonishing when you live in countries or visit countries where that trust isn't there, where people do not trust governments. So some of our thematic ecosystems have pointed out where actually countries in maybe Africa have got higher levels of digital health uptake because they trust the government despite some of the other programs. And yet in our countries with long traditions of digital health, people are saying, no, thank you, we don't trust you. So that's just a viewpoint that's perhaps a little bit different.
Very important point, Andy. And I think that there is a high risk that trust start to be challenged by new ideas, concepts, etc. And that is a danger for the whole future. Absolutely agree with you.
I have one last thing for everybody, for the audience and the speakers and the panelists. I will share my screen. now you can access to www.menti.com and enter this code to answer some short questions, and we will finish the webinar. You can do it with a smartphone or with a computer. Are you ready? Sarah? The first question is, in your view, could digitization change life and opportunities in remote and rural areas? We have 8 people saying yes. Following question, Sarah? Do you have any knowledge of whether or not these initiatives are currently running in your country? We can observe that maybe in some countries these initiatives are not being done, or maybe the participants don't know that. And the last one, Sarah, it is a word cloud, and you can write a word.
No.
That's great. Words, and we can read access, rural rules, innovation, act, future. It is not an option. Data, of course. And finally, hope. That's great. Thank you very much, all of you. I hope that this experience has been enriching for everybody. And I hope that this kind of initiatives can help to the patients in all the areas, and we can make them to be more independent as a citizens and to improve their well-being. This is our main objective. Thank you very much, everybody.